Broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. This is Deb Hill here with the Academic Collaborative for Integrative Health. Welcome, everyone, to our 2019 spring meeting of the Library Special Interest Group. We're going to get started here in just a minute with a presentation, but everybody right now, we're using our GoToWebinar platform, so everybody is in listen-only mode for the time being. There is an option to raise your hand once we get to questions, or if you have a question, feel free to hit that little button or type any questions into the question box in your GoToWebinar platform. So without further ado, I wanted to go ahead and introduce our very special guest speakers today. First, we have Dr. Natalia Aldana from the Louis Paz, I'm going to get this wrong, Paz University in Bogota, Colombia. I'm really bad at pronouncing various names, but Dr. Aldana is the director of the homeopathy program at the university, and she is a consultant for the Pan-American Health Organization, World Health Organization's Latin America and Caribbean Center on Health Sciences Information, and the editor-in-chief of today's presentation on the Virtual Health Library of the Traditional Complementary and Integrative Medicine of the Americas. So welcome, Dr. Aldana. Next up, we have Dr. Daniel Gallego, and he is a consultant for PAHO and the WHO, as well as a member of the Virtual Health Library Coordinating Team, and he is the current chair-elect of the Traditional Complementary and Integrative Health Practices section of the American Public Health Association. So welcome. So without further ado, I'm going to go ahead and switch this on over to you, Daniel, and we should be able to go from there.
Thank you very much, Deb, and thank you very much for the invitation for joining this special interest group of the collaborative meeting today. And good afternoon to you all, and thank you for joining this call. So today, Dr. Natalia has a little bit of troubles with her connection, and that's why she could not say hello, but she's saying good afternoon to you all. And I will go ahead and start with the presentation, and then later we can hear from her. So today we'll be speaking about the Traditional Complementary and Integrative Medicine Virtual Health Library. And although the name is, just give me a second, the slide is not moving forward. Here we go. The name is by itself a little bit of self-explanatory. I wanted to highlight that the virtual library, sorry, this computer is. The Virtual Health Library is a group of methodologies, tools, and information systems that was developed by the Pan American Health Organization, World Health Organization, specialized center on health sciences information 20 years ago. So it's basically a model for organizing, managing, and sharing information that, as I mentioned, has widely been tested at the regional level in the Americas, where more than 30 countries have national virtual health libraries, and there are also regional virtual health libraries that are specialized in specific topics, such as the one we're going to speak about today. I think it's also important to think about, and one easy way to think about this virtual health library space is to think about a sort of a Latin American PubMed. So this is managed by a regional library of medicine. This specialized center on health sciences information was previously known as the regional library of medicine, and initially it started to evolve it that way in starting to gather and index the health sciences information literature from the Latin American region. So to try to understand a little bit more about what the model is, it's important to understand that it is conceived as a public good. So it does not belong to PAHO. It belongs to the public. It's in the public domain, although it is administered by the WHO. I mean, the PAHO, as Dev mentioned at the beginning, PAHO, when I say PAHO, is the Pan American Health Organization, which is the regional office of the World Health Organization for the Americas region. So although PAHO manages it, it is in the public domain, and it belongs to the collaborators that put the virtual health library together, and we'll speak a little bit more about that. So the virtual health library as a model, as a strategy, seeks to create, organize, and disseminate information sources to address the needs of different stakeholders, to promote access and use of scientific evidence for decision making, coordinate and perform bibliographic control for health literature in the Latin American and the Caribbean region, increase the quality and visibility of scientific production in the region, and foster collaboration among stakeholders. So the virtual health library on traditional complementary medicine, as I mentioned at the beginning, follows that structure, stands on that infrastructure, and one of the key components of the one of the key elements of the virtual health library, of the model as such, is that each of the instances of virtual health libraries, as I was mentioning, there are 30 countries that have national virtual health libraries. Each of those instances are managed by networks of collaboration. So the first step for the establishment of the traditional complementary integrative medicine library was the creation of a network of collaborators, and that happened in June 2016 at a meeting that was organized by PAHO in Nicaragua, where 21 countries came together and shared what they were doing in terms of integration of TCIM into national healthcare systems. So once that network was set up, you see there on the screen a few pictures of that meeting. And once the network was set up, the first, let's say that the first project that became the focus of the work of that network was the development of the virtual health library. So it started with a few countries, 4 or 5 countries, and now it has grown to 14, 15 countries that are participating. One of the interesting things about this network also is that it brings together very different kinds of stakeholders, from national health authorities, so like the ministries of health, for example, to universities, large healthcare providers like the Social Security Administration in Peru, for example, research centers, professional associations, and different organizations that work in the promotion and development of TCIM in the countries of the Americas. So the network has developed different mechanisms for collaborating, for articulating the work to make it possible. including like how the network operates within each country, and also how the network develop alliances and relationships with other networks and other international bodies. So the virtual health library, the web portal as such that we're going to see a little bit in detail, was launched a year ago this week in Rio de Janeiro by the regional director of the Pan American Health Organization. You see some images of that launching event. Here you see a quick overview of the structure of the main page of the portal plus the URL, and here the view of the upper section of the website. We're going to speak a little bit about what the different sections are for the portal, and this is the lower portion of the page. So the project has, let's say, two main components, and one is the portal, the web portal itself, with the various different sections that we're going to speak a little bit about, what those sections are and how that gets put together. And it also has a search interface and a database that was put together by the network that is called Mosaico. I'm going to show you how the search interface is accessed, and in that interface it's possible to do searches from many different international and national databases. So just a quick word about Mosaico, which is the database that the network put together and that is available through the web portal of the Virtual Health Library. It indexes both peer-reviewed literature that is not currently being indexed in other databases such as Medline, PubMed, and so on. And for that, the network developed a set of inclusion and exclusion criteria of documents and a process for the decentralized document processing that is done by the network. I'm going to quickly switch here to the web browser to show you. This is the main portal. When you click here, if you say, for example, acupuncture, and you hit search, it will open automatically the search interface. I did it earlier, so we didn't wait online for it to charge the search. But so what we are seeing in the screen now is the search interface, and I just put a keyword, acupuncture, and I just wanted to show you how, for example, here we have different options to perform different filter options, including databases. So I wanted to show you that how, for example, here the interface is automatically searching into Medline. LILAC is, as I said earlier, is a Latin American and the Caribbean health sciences information database that is the equivalent of basically the Latin American Medline. And there are other national databases like QMed is the national database of health sciences in Cuba, and Mosaico is the database that I was just referring to that the network developed. And there are national IBEX is the national database of Spain, the database of the WHO, and so on and so forth. There are several databases from which, through predefined search strategies, there's a harvesting of information through this interface. I'm going back to the presentation here. And what I'm showing you here on the screen is also an advanced search tool that was put together based on a thematic structure for TCIM, for the TCIM field that was developed by the network. The experts from these countries in Latin America came together to try to arrive to an understanding of how we were going to classify and organize the information on the different traditional, complementary, and health systems and the different therapeutic modalities, and that made possible the development of this advanced search tool. So we're going to mention quickly a little bit about the different sections that are part of the web portal. So we have a directory of institutions where the stakeholders on TCIM for each of the countries that are part of the project are available, are listed. So you can find a description of the institutions and the link to the website when available, and other information and so on. We have a section dedicated to regulation and policies, where you can find the norms and regulations on practices, practitioners, and products on the different countries, with links to the actual documents. And we're going to speak a little bit also as I present to you these different sections, like what are the next steps for moving towards improving and advancing in the development of this section. So for these two that I just mentioned, we're in the process of updating the data from different countries and add information from new countries. As I mentioned, currently we have about 15 countries. In the Americas region, there are 35 countries. So we are working towards increasing the participation of new countries. We have a section dedicated to traditional medicine. And when we say traditional medicine in this context, we're specifically speaking about the traditional medicine of indigenous peoples, African descendants, and other ethnic groups in the Americas region. In general, for example, traditional Chinese medicine and the medicine of other regions, for the context of this virtual health library, is most often understood as complementary medicine, because we follow the definition that the WHO has developed for traditional and complementary medicine. So in this section, we want to increase the visibility of the information related to the different health systems, healing systems that the ethnic groups of the Americas region have been developed through thousands of years, and also support the implementation of the ethnicity and health policy of PAHO, that includes also the recognition of traditional medicine. We have a section dedicated that is titled "Understanding TCIM," where we want to have is in development, where we want to have basic information, including the different systems, the definition of what those systems are. We are working also on collecting evidence dossiers for each of those systems, as well as listing already available resources that other institutions and other organizations have been producing over the course of the years in the field. So we're in the process of developing the glossary with basic information, listing, identifying and listing resources, and updating the virtual health library structure. And we can speak a little bit more about this at the end, but one of the goals also that we have is to propose an update of the Tci M terminology. We can speak a little bit more about that at the end, which is probably of interest to you, since most of you understand are librarians or working with library services in your institutions. We have a couple of sections dedicated to both collaboration and strengthening research capacity. These two sections are mainly led by the Brazilian Academic Consortium of Integrative Health, which has been an initiative very much ingrained with the regional network, and which we hope will expand into a regional-wide consortium of researchers. This academic consortium, this Brazilian academic consortium, has actually been building bridges with the North American Academic Consortium on Integrative Health and Medicine. So for those sections, we are in the process of identifying and developing resources, as well as developing e-learning courses for strengthening research capacity. So a little bit about statistics. So even though this resource was meant to be regional, is mainly geared towards catering to a regional audience of the Americas, is actually being consulted from all over the world, as you can see in the map there, the different countries that have been visiting the resource. The country where we have the most visitors from is Brazil. And just here some basic statistics about the visitors to the site. As I mentioned, we launched the website in March 2018, and these statistics are until December. So basically, there are statistics for 9 months, the first 9 months of the site. We have also presence in social media. There's a Virtual Health Library has a Facebook page where when articles or resources are published in the Virtual Health Library get promoted, or when different events related to TCIM, where the Virtual Health Library has some presence, then is also promoted, and so on. Just here a collage of pictures, just to mention that the network has been very active since the launching 1 year ago in being visible at different spaces. In May, for example, we were able to connect with with Deb in the Baltimore meeting of the academic consortium and so on and so forth. It has been very important to us being having a presence in different national and international events to expand the network. As I was mentioning at the beginning, this is a collective effort. The project requires the participation of members for the development of the content and the development of the different activities that are planned for each of the sections. Okay, so just a quick note about the next steps. As I was just mentioning, one of our key areas of work for the next few months is the expansion of the network and the development of the virtual health library. For each of those sections I mentioned, there is an editorial committee that has been established. In some instances, an editorial committee manages 2 sections, such as there's one editorial committee for the section dedicated to the academic consortium and the strengthening of research capacity, for example. But those committees have developed editorial policies and a plan of action for the development of each of those sections I mentioned, and there are other sections also that I didn't mention in the presentation, so we didn't make it too long. But one of our key priorities for this year is the implementation of each of those action plans for the content development of each of those sections. The strengthening of information sources, as I mentioned, and we want to expand the Mosaico database. Currently, we have registered about 1,300 documents in the Mosaico database that are mainly we are registering there, for example, thesis and master thesis and dissertations on the field from the Americas region, technical reports from research projects of the health ministries, technical documents or guidelines that different institutions, including health ministries, issue, journals that are peer reviewed, but they are not currently indexed in other databases, white papers and other relevant documents that comply with the inclusion criteria that have been defined for the database. And of course, we also want to keep refining the search strategies that make possible the data harvesting from external databases. As I show you, through the interface of the portal, we are able to access information from several other sources, and that process of harvesting that information through search strategies needs continued needs continued attention and refinement, so we can guarantee and maximize the relevance of the results once a user uses the tool. So, and as I mentioned in the presentation, one of the projects we have is to work on the review of the Tci M terminology. As I mentioned at the beginning, during the presentation, when we were developing a thematic structure to define how the information in the web portal and in the database was going to be organized through this thematic structure. We did a review of the existing terminology, both at the National Library of Medicine, a review of the mesh terms, and also the DEX. The DEX, which are the health sciences descriptors, is basically a translation of the mesh and a translation and expansion of the mesh. There are different groups. There are different terminology groups that are in the DEX and the health sciences descriptors of PAHO that PAHO manages that are not included in the mesh. And so one of the things we observe during that review process is that the terms, the terminology tree currently available in the mesh by the National Library of Medicine do not reflect the complexity of the TCIM field. And we have directly addressed these at the National Library of Medicine, as well as at the ACIH. And we have had some conversations about the possibility of exploring a project to do a broad review of the control terminology, which could eventually also include the participation of the WHO, with whom we have also have discussions about it. Okay, so I think that is the core message we have for you on the presentation. We thank you once again for inviting us, and to the collaborative for inviting us, and to all of you who have joined the call today. I wanted to leave you with a few pictures of members of the network from the various countries, as well as from the team, the technical team of the Latin American Center for Health Sciences Information that handles the technical aspects of the platform, and that have made also possible the development of the virtual health library. There's the contact information. We will make this presentation available to you all, and perhaps also some other communication materials. And I will then pass the mic to Natalia in case she would like to complement something at this point, or we could move on to a discussion.
And hi everybody, I apologize because at the beginning of the meeting I just got up with my wireless connection, and I think that Daniel did the complete explanation of the project, and so right now I don't have anything to add, but we are open to all your questions or your comments or suggestions, or yes, or any question that you need to do, or something that you need talk about. Thank you.
Thank you both. This is Deb. That was an excellent presentation and overview. I know that we have one question up already from Alyssa, and anybody else, if you want to go ahead and raise your hand, I can unmute you, or you can type your questions into the box if you have any questions. But Alyssa, I think I have you ready to go.
Great, thank you. Thanks, Deb. Thank you, Natalia. Thank you, Daniel. This is a fascinating project, and just so much depth and width and impact. So thanks so much for giving us a good presentation about its scope and your goals and objectives around it. So I did have a question about your goals and objectives, and I'm just curious. I mean, you did put up a screenshot of your users. Of course, it's early on since you've launched. So it's looking like you're getting a good amount of traffic. I was wondering about your goals in that respect, and other ways that you might be measuring impact in engagement, either in the present or as you envision the visibility growing around the project.
Thank you. Natalia will correct me if, but from my perspective, or so far, we have not set specific goals in terms of the number of users we would like per month, and so on and so forth in terms of traffic. We have been, we kind of launched the website without any kind of specific expectations, or kind of not actually knowing how many users we may have per month and so on. We have been satisfied with the level of visits in general. One of the metrics that we have been seeing is the duration of the sections for each of the users, and they are, in average, the sessions are only about 3 minutes, and we think that that is related to the fact that the content, that we still need to develop content, that many of the sections still do not have the level of resources and the amount of resources and the depth to which we want to get, and so we are hoping that the engagement of users increase if we can, like, at least partially measure it with the duration of the sections of the users. But yeah, I mean, we don't have a specific set goals in terms of that. I think our goals are more functional, I guess, in terms of we want to have solid resources so that stakeholders across the region can make decisions. So at some point, if we were to define indicators, for example, we will have to measure or find ways of assessing whether decision makers in healthcare systems are using our website to make decisions regarding TCIM, integration of TCIM in healthcare systems, or of decisions regarding the availability and access of services, TCIM services in healthcare systems, and decisions regarding the transformation of policies. I think we would like to head more towards those kinds of goals than traffic related ones. Of course, they are related, but that's where we would like to head towards. I don't know if Natalia has something to add.
And now, right now, we don't have a specific goal of the audience of our visitors, but each time that we have the opportunity, and each seminar or web conference, or even in the international meetings, we try to show the different possibilities and the different options that we are offering with the library. For us, like Daniel says before, for us it's just it's not just a database, it's more than that. Something that Dcim has, like a big goal, or is try to put in easy words the whole information. So that's why we have a lot of sections there that are trying to put the information that are in the scientific journals and even in the thesis or even in the different academic documents or in the articles, putting all that whole information in some words that could be easier for the patients, for the general public, and also for the other health professionals. So maybe we are a little ambitious with that because we don't have a defined public, but we are expecting in some level that the virtual health library on TCIM could be useful for different kinds of publics. That was yes, I think that would be something more to add.
Thanks so much for your answer. That was really helpful.
Great. Thank you. Thank you so much for that. Alyssa, did you have any other questions?
Not for me. Thanks.
Okay. So I had a couple of questions. This is Deb. So I just heard you state, and maybe I just wanted to clarify this, but you see this more as used for both public and researchers and policymakers. Is that broad definition, or are you focusing on one of those in particular?
We have a broad definition of the kind of public we would like, the kinds of users we would like to target the content of the virtual health library. And we hope through the different sections to be able to offer resources for specific subsets of those users. So in general, like, healthcare professionals, whether or not are informed about the TCIM field, is one of our key target populations. So for example, the section that is dedicated to, or that is titled Understanding TCIM, for example, is targeted mainly to health professionals, to help them understand, to help them make sense of what the TCIM field is, and to help them realize that there is evidence supporting many of the practices, and also to highlight like where the gaps are, and what needs more research, which areas need more research. That section should also be useful to the general public, for example, so it serves a dual purpose. There's a section, for example, as I mentioned, dedicated to collecting and making available the health policies and the regulations on practices, practitioners, and products through of the countries of the region, and that is useful for researchers, and that is useful also for practitioners, and that is also useful for decision makers. So that the decision maker in a country wanting to try to make sense of what other countries are doing can very easily access a resource that is listing in an organized fashion what other countries are doing, what the policies are, what the regulations are, and so on and so forth. And the same applies, for example, in the previous section I was saying, like where we hope to have like evidence synthesis and evidence maps and evidence dossiers of the different practices. It can help decision makers make informed decisions about, okay, like which healing system makes sense to integrate in a specific service or which one do not, for example. There's a section I did not speak about during the presentation that is, for example, dedicated to self-care. So self-care tools from the perspective of TCIM. So and where we are hoping, we are in the process of developing, for example, a virtual a virtual course targeted to help professionals, to help them understand like what the TCIM has to offer in terms of self-care options and how and what they can do to educate their patients, or how they can guide their patients to access resources related to that. And we are hoping in that section, for example, to have also very basic communication materials or very different resources that can help the general public to understand like how TCIM practices and services could help them to take care of themselves. So like that section will also be taking, I mean, it will also be aimed at the general public, and so on and so forth. So we have different populations in mind, and different sections catered, some of them to several of those subpopulation groups, and others are more specific for a specific population group of stakeholders, and so on and so forth.
Great. Thank you for that explanation. It does sound like it is broad-reaching, and I like working towards even a virtual course and some of the other things that you're working on, including the different mesh terms and redefining that. So there's a lot going on. Very exciting. The only other question that I did have that came to mind is, I know that you've been building out the Mosaico database, and I'm just wondering if you could kind of walk me through what the process. I think you said that there's some inclusion criteria for what's included in the database. If there's a process as to how things are added to your database.
Yes, let me see if I can switch here to the site, and I can show you. So there's a document that says what the database is, what kinds of documents could be indexed in the database, and the process for registering those documents. So we have. Let me. I don't know if are you seeing my screen?
I am seeing your screen. Yes.
Okay. So when you click here in the About menu, you go to the Mosaico database. It explains to you like what the database is, and so on, and the coverage, the different criteria for inclusion of documents, and you can click to the more detailed selection criteria for the document, and it give you all that. So, as I mentioned, we are standing or sitting, let's say, on an already existing infrastructure, and that infrastructure is the regional library of medicine, the virtual health library model, and that model relies on decentralized information processing. So, for example, and it's different from what the National Library of Medicine does, for example. So, the National Library of Medicine receives the package of journals that they have defined that they will index in Medline, for example, and they do in-house processing of all that information. But for example, for the virtual health library, each institution that becomes part of the network receives training on how to register the documents in the databases, because the virtual health library, the regional virtual health library, has different databases. And so librarians at universities or at hospitals, research centers, receive a passport, receive training and a passport on how to register that information and the selection criteria for the documents and so on. And there's a quality control mechanism that at the Regional Library of Medicine where that information entry gets reviewed and so on. And there are checks about that. Yeah, that's more or less how it goes. So basically, in every country that participates, there's people that are trained. Like, for example, if there's a university, that has a training program in complementary medicine in whatever modality, and so we train the librarian of that university, so they enter their own thesis and dissertations and or white papers and or their local production.
Perfect. That sounds like a so obviously then as you grow your network, you'll end up with more and more, and it's coming in and gets larger and larger as you get more within your network.
Yes, correct.
Yep.
The idea is we would like to have a presence in as many countries as possible of the region. As I say, there is at least 30 countries that have, like, where there's a national network of virtual health library that predates our thematic virtual health library. So and we work closely with the people that have been developed those national networks for the regional health library. We work closely with them because often librarians in many of those institutions are already trained. For example, the National University in Colombia, to give an example, they have a medical library. That medical library is part of the national network of the virtual health library, and but they also have a master's program it's a master's program in alternative medicine, and they have production, they have thesis and so on. So we don't have to train the librarian of that university because they are already entering data from the medical school. What we need to do is to help establish the mechanism and the link between the different programs and the different instances within the same institution to have the flow of information, and perhaps also retrain that librarian to say, okay, this is a new database that is thematic, and as I mentioned, through the virtual health library, the regional library of medicine has different databases. So like and so we retrain the librarians on the selection criteria for this new database and so on. And where that capacity does not exist previously, then we of course then train the people at those institutions. We have had instances also where there are institutions that produce documents, but they do not have a library on their own. And what we have been doing also is then we process those centrally. Through the website, there is also the option of submitting both contents, suggestions for content, and documents. So if you see here in the screen, this box here is you can suggest documents and content, and if you go there, you will access a set of questionnaires for suggesting either modifications to already existing content, for the virtual health library, for the database, for the news section, or for the events section. So I forgot to mention that, for example, we have a section on news that are suggested by the members of the network, where they say, for example, if you look at what is on the screen now, for example, there are currently 2 notes from Argentina, 1 note from Cuba, where the network members speak about the different events or different initiatives they have been working on, and so on. Or sometimes there are topic-specific news. And then there's also a directory of events, where is a plugin that automatically moves the events as in chronological order as they approach, and drops them once they have passed, and where people can consult also the events or suggest events, submit events to be published in the library. So here you can, in this the events plugin, where you have the list of events and a calendar, and you can also do search by different categories of events, and so and I think one something that is important to always keep in mind that this is not a finished project. You know, we're kind of trying to show where we are and where we want to head towards, and also through that process also engage new potential partners. We rely on members for the processing of content and the creation of content for the virtual health library. For example, as I was saying, like, so for each country, so we have a section that is called, for example, directory, where the different institutions from each country are listed. So, for example, so the members of each country, the members of the network from each country, review the information and update it and so on, and then it gets published. There's a need of updating and reviewing the information of some countries. There are some countries that have been more active than others, because, as I say, like, we rely on the members from each country to process and submit the information. So, for example, from the US, there's a lot of work that needs to be done in terms of adequately mapping the different institutions that are important in the US, or in the different categories. I believe the collaborative is, I think, in international network. Let me see where the collaborative is, maybe in the US. Networks. Okay, so here I went to the US, and then I went to networks, and here we have the consortium, the Integrative Health Policy Consortium, the Academic Collaborative, Academic Consortium for Integrative Medicine and Health, and so on. So that directory is organized by categories, and as I say, I mean, those that have been working with us, that is what we have received from the US, and there are other institutions, but there's much work that needs to be done for updating and reviewing and making more relevant information available for that. And another thing I wanted to highlight is that so basically for each of those, as I mentioned, for each of those sections that the virtual health library has, there is a working plan. There are editorial policies, and there's a goal and a direction where each of the committees that manage those sections want to head towards. We are starting also now to develop partnerships with universities to implement activities and projects that are aligned with those policies, those editorial policies of each of those sections, to develop content, to develop resources, and implement some of those activities through student-led projects, master's thesis, capstone projects, and so on and so forth. We are doing it now with schools that have training programs on TCIM. We have also been exploring partnerships with schools that train librarians. And so we are also trying to build, find different avenues for implementing the activities and plan of action to get each of those sections where we want them to be. And I would like those in the call to have that in mind, to have in case you think there's a potential for collaboration that could be mutually beneficial for your institutions, your students, when those institutions are educational institutions, and or when those institutions produce other different kinds of resources where there might be potential for partnership to develop products and that could be available to anyone. As I mentioned at the beginning, this is a public good. This belongs to everyone. There's no, it's the network as such, are all the members who own it is on the public domain. So everything is available to the public.
Wonderful. Well, you've given us a great overview. This is a really robust project with lots of wonderful information. And as you said, it's still a work in progress, so I expect to see more changes as we move forward. I did notice that we are at 1 hour here, and we do like to try to keep our meetings around that point. I'm sure that everybody on the call, if you have any other questions, we can go ahead and communicate via email as well. So feel free to reach out to me directly, Deb, here at the collaborative, and we'll make sure that everybody gets connected if there are any extra questions. But I want to thank you both so much for your time today. This is such a great project, and it's really great to hear more about it. And with that, I think we will end our meeting today. So thank you again.
Thank you again for the invitation, and to all of you who joined the call. And of course, yes, we are available to any further communication. Thanks again.
Perfect. Wonderful. Thanks.
Yes, thank you, everybody.
Thank you.
And Deb, you can just share with everyone our mail. We can answer the different questions of each one by the mail. That could be one option. Thank you all.
So my follow-up, when once I have the recording ready here, we'll make sure to send that out to our group and include your contact information as well, your email.
Yes, we'll make the presentation available as well.
Perfect. All right. Thank you both so much. Great
Thank
to hear
you.
from you. Have a great rest of the week.
Thank you.
Thank you.